The final item of business today is the members' business debate on motion number 12192 in the name of Dennis Robertson on Eating Disorders Awareness Week 2015. This debate will be concluded without any questions being put, and I would be grateful if members who wish to participate could press the request to speak buttons now, please. And I call on Dennis Robertson to open the debate. Around 7 minutes, please, Mr Robertson.
Thank you, Presiding Officer. Can I first of all begin by thanking all those members that supported this motion in order for me to take forward the debate this evening. And can I welcome members to the gallery who are here from the diabetics with eating disorders, and members who will be participating in an event this evening in Committee Room 4 after this debate. Presiding Officer, prior to this debate, I asked myself, why? Why am I doing this? And the answer is really quite simple. We still need to continue raising the awareness for people with eating disorders within the medical profession. It was once said to me, Presiding Officer, that things only change death by death. I'm actually hoping to take a much more positive view on this. I'm hoping things change by raising awareness, by awareness, by awareness. Presiding Officer, this is the third time I've come to the Chamber in raising the awareness. And one of them perhaps is that related to those with diabetes. And Presiding Officer, I had no idea when I first came to this Chamber, or when I first became aware of eating disorders, I had no idea of those with diabetes and eating disorders. They are 5 times more prevalent in terms of the mortality than those with anorexia nervosa. A shocking statistic to me. And it would appear, Presiding Officer, that those with diabetes and eating disorders still don't have a recognised diagnosis. There's no medical name attached to this condition, as far as I'm aware. But hopefully in raising this awareness and bringing this to Parliament and having an event here and listening to the clinicians and having the Minister attend, perhaps we will make some strides forward in listening to their story. Presiding Officer, the Chamber.
Thank you, Presiding Officer. Can I congratulate my colleague Dennis Robertson on bringing this debate to the Chamber. Dennis has brought a number of debates on this very important issue to the Chamber, which obviously, as he's highlighted on every occasion, is something which has affected him quite profoundly. And I think it is a great testament to Dennis the huge amount of awareness that now exists within this Chamber and within wider society around issues relating to eating disorders and the mental health aspects in relation to that. I want to focus my comments around the issues of diabetes and eating disorders. I spoke with the individuals at the Diabetics with Eating Disorder stall earlier on today. And one of the issues that was raised during my discussion was that it's not enough to just focus on the issue around educating individuals on use of insulin, because you're dealing with people who know exactly how to use their insulin, and not just how to use it, but how to manipulate it in order to affect their weight as a consequence of that. And I want to talk about a constituent of mine, Emma, who I first met during my by-election campaign in 2013. And Emma identified as a diabulimic. The condition occurs when insulin-dependent diabetics skip injection in order to lose weight. Emma herself had been admitted to hospital on multiple occasions for diabetic ketoacidosis, or DKA, and her feeling was that at the time this perhaps should have sounded alarm bells and should have led to a deeper understanding of the condition that affected her. And so after meeting with Emma and then returning to Parliament following the by-election, I put down a parliamentary question on the issue of diabulimia. I asked the Scottish Government what guidance it had issued to NHS boards in respect of the diagnosis and treatment of diabulimia. The reply from the Minister, Michael Matheson, said in 2006 guidance was issued to NHS boards on the management and treatment of eating disorders in Scotland. While diabulimia is not specifically included, we expect principles and good practice around care and treatment of individuals will be applicable to this cohort of people. And I would say to the Minister that this is maybe something that merits some examination. I'm aware from the conversation I had at the Diabetics with Eating Disorders stall that there is now some progress in terms of inclusion within the DSM-5, in terms of the list of identified mental health conditions, but that chronic insulin deprivation or failure to take insulin has not yet been readily identified in its own right. And there was an issue raised with me about the cohesion between physical and mental health. We often talk about the parity between physical and mental health, and that is absolutely vital, but there's an element of cohesion when it comes to diabetics with eating disorders, because where you have the physical health of the individual being looked at, but not necessarily the mental health, and vice versa, it means that potentially those dealing with diabetics with eating disorders are not treating the individual in a cohesive and holistic fashion. So I would ask the Minister to maybe have a look at that and see whether there needs to be some update to the guidance or some further guidance in relation specifically to eating disorders as they affect diabetics, because I think that would be very welcome, certainly from my constituent Emma, and I suspect from other diabetics who are affected by eating disorders.
Yes, thank you very much to notice it, because again, it's a praise we have to direct to Denis. When Denis said that he had no idea, what he didn't realize is we had no idea, and most of us had absolutely no idea before Denis Robertson brought it to this chamber. And he was honest enough to say he had no idea. And what I would like to finish on this, Presiding Officer, it's families have no idea. We can't, as a father, Denis Robertson, or us, me as a friend of the family, I had no idea what patients are going through. And we have to accept that fact, that people who are not suffering from this illness have no idea. So we have to see that help and support to families, to friends, to relatives, have to be tailor-made to make them understand from day one that we have no idea, and we need to let the process and the clinician going through what they need to do best. So, in conclusion, I would like to say again how much admiration Denis Robertson has in this field. And I spoke to Jacqueline Ocera, which both of them we're going to hear tonight, and they told me about the great admiration they have for Denis Robertson. Presiding Officer.
Many people don't associate eating disorders with conditions like osteoporosis, type 1 diabetes, organ failure and other mental health conditions, and I commend Denis Robertson for highlighting this in his motion. The motion rightly emphasises the worrying figures from NHS ISD regarding the number of people in Scotland who ask for medical help or treatment each year. A significant number, but one which almost certainly masks the so far unidentified people who have one of the disorders, but for a variety of reasons do not seek help.
It is often associated with people who feel that they have lost control of their own lives. It is also prevalent in young people whose lives change quickly and uncontrollably during puberty and indeed in growing up. And surely that signals that young people are naturally more at risk. And you can see how this loss of control would also be an attribute of developing type 1 diabetes. That these extreme eating disorders are difficult to understand shows that they will be difficult to treat because the sufferers have already overcome their natural instinct to protect and nourish themselves. There needs to be more understanding of the causes as well as better research into treatments. There are very few specialist centres, meaning people don't receive the treatment they require. There also appears to be an ignorance within the health service as to how they should be treated in the first place. We need to have much more dedicated mental health services for young people with eating disorders, and indeed dedicated services for those who would self-harm as well, something that we're missing. We need to understand these conditions and put in early intervention to help sufferers. It's sad that young people tend to have to leave home, loved ones, and travel some very great distances to access quality care. And I think that needs to change, because at a time in their lives when young people are vulnerable, they need to be close to their family and friends.
And indeed, I want to also focus on relation to, in particular, the issue of the prevalence of those with an eating disorder who also have a diagnosis of diabetes. I will be attending the parliamentary reception after this debate, and I look forward to learning more there. What I would say, of course, is that this government has published a diabetes improvement plan, published in November of last year, which sets out a range of actions to support people living with diabetes. Actions within the plan include a focus on prevention of complications, improving glycaemic control, crucially reducing disengagement from services and improving outcomes for disadvantaged and minority groups. I should say that through the Scottish Diabetes Group we did fund the Psychology in Diabetes pilot project, which has now concluded, and we expect the lessons learnt from this to be shared appropriately across health boards in Scotland, and work is ongoing to consider how best to disseminate the learning and outcomes of this pilot, and if it's appropriate to update our guidance accordingly, then of course we will seek to do so.
Days when you could smile, when you would just stay there far away. Do you remember when you played as a child, fell on the grass, then lay there for I'll take the wheel, the road will set me free. I'm going that won't stop the pain.